This data shows that we can. North Carolina will move into a safer at home phase 2 on Friday, May 22nd at 5 p.m. Phase 2 is another careful step forward. Since we announced phase 1, the state's overall key indicators remain stable. However, the increases in the COVID-19 cases signal a need to take a more modest step forward in phase 2 than originally envisioned. While I am lifting the stay-at-home order, we are shifting to a safer-at-home recommendation. And that's especially important for vulnerable people who are at risk for more severe illness. Teleworking, when possible, is also highly recommended. Safer at home means just what it says. Just because you can go more places doesn't mean you always should. Now, some businesses and places will remain closed in phase 2, including bars, nightclubs, gyms, and indoor fitness facilities, indoor entertainment venues such as movie theaters, bowling alleys, and museums, and public playgrounds. This is because the potential spread of COVID-19 can be significant there. The mass gathering limits in phase 2 will be no more than 10 people indoors or 25 people outdoors. And this applies to event venues, conference centers, stadiums and sports arenas, amphitheaters, and groups at parks or beaches. When people gather together, one person can be the spark to spread the virus to many. Now, certain businesses will be able to open at limited capacity with other requirements. Restaurants can reopen for dine-in customers at mostly a 50% capacity with distancing and cleaning requirements. Personal care businesses like salons and barbers can also reopen at 50% capacity. These businesses will have face covering and cleaning requirements while also reducing the number of people in the waiting areas. Swimming pools will be able to open at 50% capacity, and overnight and day camps can open with safety rules. Child care facilities remain open and are now able to enroll all children. I want to thank our child care centers that have been open. They've been taking enhanced precautions and they've been providing a critical service. As with previous orders, these restrictions are a floor. Local governments may enact more strict rules if health officials and local leaders believe it's in their best interest and in the best interest of the health of their communities. Now, this next phase can help us boost our economy, and that's important. But we can only help our economy when people have confidence in their own safety, which is why it's important to ease restrictions carefully and use data like Dr. Cohen was talking about in deciding when to do it. Now, I know this virus has upended life for many North Carolinians, especially those who've lost their incomes. And I've directed the Division of Employment Security to improve the efficiency and customer service of the unemployment benefits process. In Safer at Home, Phase 2, the 3 W's are even more important. Wash your hands frequently, wait 6 feet apart from other people, and wear a face covering. Remember, the face covering is more about protecting other people from your germs in case you have the virus and just don't know it yet. A face covering signifies strength and compassion for others. Wearing one means that you actually care about other people's health. And I'm proud every day here at the Emergency Operations Center when I see our brave National Guard soldiers and tough Marine Mike Sprayberry using them. Finally, I'd ask us all to be patient and understanding of the frontline heroes who are running cash registers, driving delivery routes, and helping customers, especially those businesses that will just be opening this weekend. Not every restaurant and salon will be able to open Friday evening, and some may choose not to open at all. Show them the courtesy of patience that as they weigh how to best serve their customers and to stay safe. We owe that to them. And let's keep looking out for our neighbors, thanking our frontline workers, getting some fresh air when we can, and working together to defeat this virus. With me today is Dr. Cohen, our Secretary of the Department of Health and Human Services. Our Secretary of Public Safety, Eric Hooks, is with us, along with Director of Emergency Management, Mike Sprayberry. Karen Magoon and Nicole Fox are our sign language interpreters. And behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. So we're going to take questions from the media, and if you could identify yourself and your organization when you call in, we'll take the first one.
Our first question will be from Colleen Quigley, WNCN.
Good afternoon, Governor Cooper and everyone. Thanks for taking my question. It's in regards to local law enforcement leaders in past saying they wouldn't enforce parts of your executive orders. What is going to be your message going forward when asking people to keep their businesses, their bar, their restaurants, their salons at 50%? How are you going to make sure that's enforced?
Most of law enforcement across this state is doing what they should do and are enforcing the law, and they're doing it in a good way. They're telling people about the order, they're taking complaints from people, and they're going to see people who may be in violation of the order. And most North Carolinians are doing their best to follow the orders and doing their best to keep their families and their neighbors safe from this virus. I believe that most of the law enforcement in North Carolina want to keep people healthy. And I think many of them will welcome this cautious move into phase 2. One of the things I've heard from a lot of people is that we need to get our restaurants open and our personal care salons, people getting haircut, those kinds of things. That's going to happen now, and it's going to be done in a safe way. So we hope that everybody can stick together, look out for each other, and that most people will follow these orders and will do what they need to do to wash their hands and wear a cloth face covering and wait 6 feet apart from other people. We've still got some work to do.